Have you recently had a green light laser prostatectomy to manage your urinary symptoms caused by an enlarged prostate? Or are you scheduled for this procedure soon? If that's the case, you're probably wondering what comes next. Will it be painful? How long will recovery take? When can you return to your usual activities, or even enjoy intimacy again? In this video, we're going to walk you through the recovery process, step by step. You'll get insights based on the experiences of thousands of men who've been through exactly what you're going through. Whether you've already had the procedure or are preparing for it, this information can help you feel more confident and more in control of your recovery. Most men spend just one night in the hospital. After the catheter is removed the next morning, you'll be assessed to make sure you're urinating well enough to go home. That part is usually straightforward, but healing doesn't stop there. In fact, it's just beginning. You see, there are two parts to recovery. The first is physical healing from the surgery itself. The second, and often more important, is the recovery of your bladder. Over time, when your prostate grows and blocks the flow of urine, your bladder has to work harder. It gets thicker, more rigid, and more sensitive. Even after the obstruction is removed, your bladder still needs time to reset and function normally again. Most men notice a stronger, easier urine flow within just a few days after surgery. That's the good news. But those irritative symptoms, like urgency, frequent urination, and waking up at night, may take longer to improve. On average, it can take around 3 months for the bladder to fully adjust. For some men, especially older men or those with more severe symptoms before surgery, it might take a bit longer. Now, there are a few things that can make these bladder symptoms worse during recovery, and they're surprisingly common. Drinking coffee or tea can irritate the bladder because of the caffeine. Many men also think they should drink tons of water to flush things out, but overhydrating can actually overwhelm your bladder. Alcohol, especially beer, is another major irritant. It's not just more fluid, it's a diuretic, which forces your bladder to work overtime. So if you drink caffeine in the morning, 2 or 3 liters of water throughout the day, and beer in the evening, you've just created the perfect storm for urgency and frequency. It won't cause permanent harm, but it will definitely make your recovery more uncomfortable. There's something else to be aware of if you have type 2 diabetes and take medications to control your blood sugar. Some of these drugs pull glucose into your urine and with it, extra fluid. This acts like a mild diuretic and can make your bladder fill up faster and trigger urgency more frequently. It's something to keep in mind if you notice persistent symptoms during recovery. Let's talk about catheters. Yes, every man receives a catheter after this type of procedure. In most cases, it stays in overnight and is removed the next morning. After that, your ability to urinate is assessed, usually with 3 full voids followed by quick ultrasounds to ensure you're not retaining urine. Some men may need the catheter a bit longer, especially if they had a larger prostate, a longer procedure, or significant retention before surgery. In some more complex cases, longer-term support may be required, but that's less common and handled on a case-by-case basis. Another thing men often ask about is sexual activity. Most can resume sexual activity about 2 weeks after surgery, as long as they're feeling up to it. But one important change to be aware of is retrograde ejaculation. This means that during orgasm, semen goes backward into the bladder instead of exiting through the penis. It's a common result of procedures where prostate tissue is removed. For some men, the sensation remains the same, or even becomes more intense. For others, it may feel different or less satisfying. Either way, it's not harmful and doesn't affect your ability to have an orgasm. It just changes the experience. Now, how soon can you return to work? If your job is mostly sedentary, like an office job, you can usually return after about a week. But if your work involves heavy lifting, climbing, tools, or any physical strain, it's best to wait at least 2 to 3 weeks. Why? Because overexerting yourself too soon can cause internal healing tissue, basically scabs, to break open. That can lead to more bleeding and setbacks in your recovery, so take it slow. Let your body heal. Speaking of bleeding, it's very common to see some blood in your urine after the procedure. Remember, the area inside your prostate is healing. You might think of it like a mouth ulcer. It takes time for the raw surface to regenerate. A small amount of blood in urine can look dramatic, but it's usually not a cause for concern. If you're ever unsure, you can collect a urine sample in a clear container and compare it over time, or contact your healthcare provider. It's also completely normal to pass small bits of tissue during urination, especially around 10 to 14 days after surgery. This is a result of the healing scab tissue inside the prostate separating and being flushed out. It may look like soft, spongy pieces or mucus. If you see this, don't panic. It's part of the natural healing process. Now here's something important to consider. Even after successful surgery, maintaining good prostate health over time is essential. Many men ask if there's anything they can do naturally to support their prostate after the procedure, or even to avoid surgery in the future. If that's something you're thinking about, there's a powerful supplement that's been helping thousands of men improve their prostate health, naturally and effectively. It's made with scientifically studied ingredients that support a stronger and steadier urine flow, fewer nighttime trips to the bathroom, better bladder control, and overall prostate wellness. If you're serious about taking care of your prostate, whether you're in recovery or just want to stay ahead of the game, this is something worth looking into. Click the link in the description now to learn more about how it works, and how it might help you too. Thousands of men have already experienced real, meaningful results. You could be next. And remember, every man's recovery is a little different. If you ever have questions or concerns, don't hesitate to check in with your urologist. This journey is about getting your quality of life back, and the more informed and supported you are, the better. If this video helped you, be sure to give it a like, drop your thoughts or questions in the comments, and subscribe for more videos about men's health. And again, don't forget to check the description below for more information about that powerful, natural prostate support. Until next time, take care of your health and take care of your prostate.